For a pregnant woman, a healthy baby is always wanted. What isn't thought about is a healthy placenta. The placenta provides oxygen and nutrients to the baby and removes waste products from the baby's blood. It attaches to the wall of the uterus, and the baby's umbilical cord comes from it. In most pregnancies, the placenta attaches at the top or the side of the uterus. In some cases, there's an abnormality with the placenta. This video will take you through 3 different placental abnormalities and teach you how to recognize and act.
So our first patient, Noelle, had a placental abnormality called placenta previa. This is when the placenta attaches the lower area of the uterus, rather than the top or the side of the uterus. This happens 1 in 300.
Good morning. My name is Allison. I'll be your nurse today. So this is your second pregnancy?
Yeah.
Okay. And how many, is it just one or?
It's my second one and I'm having twins.
Okay. Was your first pregnancy vaginal or C-section?
C6.
Okay. And what's your gestational age?
Right now I'm 25 weeks pregnant.
When I was gathering the history from Noelle, I saw some instant risk factors for placenta previa. This being her second delivery, that she's carrying more than one fetus, and has a history of a C-section were all risk factors. Additional risk factors would be having placenta previa previously, being 35 or older, African or Asian, and smoking. And what brings you in today?
Actually, last night I had a little bit of bleeding.
Okay.
Yeah, so I just got a little bit worried and I made it.
Okay. Was there any pain with the bleeding?
No, there wasn't. It was light.
One of the classic symptoms of placenta previa is a sudden onset of uterine bleeding. This bleeding is painless and occurs in the last half of pregnancy. As you can see, Noelle is at 25 weeks gestational age. The bleeding ranges anywhere from light to heavy and is bright and red in color. Some women also experience contractions. One of the ways we diagnose placenta previa is through ultrasound, either during a routine prenatal appointment or after an episode of vaginal bleeding.
Just want to check and see where the location of your placenta is, because some of the symptoms that you're showing show placental previa. Go ahead and check that, okay? It looks like you have a marginal previa, which means that
There are 3 types of placenta previa. Marginal, which is a placenta implanted on the lower uterus, but its lower border is greater than 3 centimeters from the cervical opening. Partial, where the lower border is within 3 centimeters of the opening. And lastly, total, is when the placenta completely covers the cervical opening.
bleeding lightly, you'll be able to go home, but you'll have to be on bed rest, avoid sex, and no exercise.
Once the patient has heavier bleeding, she will need to be on hospital bed rest, may need blood transfusions, and medication to prevent preterm labor. If bleeding is excessive and does not stop, immediate C-section or delivery will be needed.
This is Zoe. She's in her 3rd trimester of pregnancy. She may seem like her pregnancy is going smooth, but she has a placental abnormality. She doesn't realize this yet. When suddenly,
I have vaginal bleeding.
Placenta accreta is when the placenta is abnormally adhered to the uterine muscle. You may not have any signs or symptoms, but if you have vaginal bleeding and you're in your 3rd trimester, call your doctor immediately. Women who have had a C-section or previous childbirth or are over 35 are at risk for placenta accreta.
Some complications include intrapartum or severe postpartum hemorrhage, and that's due to retained placenta or premature birth. And treatment would also include blood transfusion, medications, bed rest, or early C-section.
So call your doctor today if you have bleeding in your 3rd trimester.
Woo!
The last abnormality is a placental abruption. This is uncommon, but yet very serious complication. In placental abruption, the placenta prematurely separates, causing fetal and maternal bleeding, and a formation of a hematoma on the maternal side of the placenta. The vaginal bleeding can be apparent or concealed. The severity depends on the amount and the size of the hematoma. Some risk factors include high blood pressure, abdominal trauma, substance abuse, premature rupture of membranes, and ages greater than 40. This puts women in danger for hemorrhage and hypovolemic shock. If this is left untreated, it will put the baby and mother in jeopardy.
She needs help.
I'm having so much back pain and stomach pain.
Okay, just
It's out of nowhere.
both of you just go have a seat over there, and then the nurse will be right with you. Okay, come on.
Thank you.
Please come this way. Are you having any contractions?
Yes, I am.
Come this
it's
way.
so fast, one after another.
Take a seat. Have you felt your water break, Nicole?
No, I haven't, but I have some bleeding now.
That was a big red flag for a severe placental complication known as abruption. She's having classic symptoms such as vaginal bleeding, severe back pain, stomach pain, and rapid uterine contractions. If the baby is before 34 weeks, she would need to be monitored. In this case, she's at 37 weeks. If this continues to progress, we will need to do an immediate C-section.
Oh, it's getting worse. I don't think I can take it anymore.
I'm just going to take a look at the monitor, see how your baby's doing, okay?
Okay.
Okay, so it looks like I'm looking at absent variability right now. I'm going to have to do an emergency C-section.
Not ready for this. I wasn't ready for this today.
We need to do this now or your life and your baby's life will be in danger. I need to call your doctor right now.
We're here. Hi, Nicole. How are you feeling?
I'm not.
Let me see. Oh my goodness, and now you guys page me? All right, let me go get ready for surgery. We're gonna have to prep her for C-section. I'll be right back. All right, okay, ready? Everybody did a count? Yeah. Okay. All right.
It's okay, sweetie. It's okay, we can get through this.
Okay.
A football hole.
Baby's latching so well. Oh my gosh.
We need like a cheese No, that was perfect though.
Dang it, why did it so slow?
Here.
One, go.
No, don't worry.
Abrasion and smoking.
Beautiful.
You're